Check out this new Fox News poll. It shows 54% of Americans would rather Congress do nothing about health care reform, but the Senate thinks they've come to a compromise that could work. It's to allow those 55 and older to buy into Medicare. So is this compromise bipartisan? Joining us now is Missouri Democratic Senator Claire McCaskill and South Dakota Republican Senator John Thune. So great to have both of you with me on a Friday. Good morning.
Good morning, Gretchen.
Senator McCaskill, there was a lot of talk over the last few days that this group of 10 Democrats had come together and had come up with a new plan that they thought for sure would pass, that it would appease the moderates. The public option would technically be out, and there would be this sort of Medicare expansion. You're a moderate Democrat. Are you in favor of this new kind of plan?
Well, I have to wait and see the numbers. This bill has to save our government money, and it has to stabilize health care costs for most Americans. They are going up and up every year, and so those are the two things that have to happen in this bill before I'll support it. So we're all waiting to see the numbers that will come back from the Congressional Budget Office to see what the financials are.
Senator Thune, so much seems to be always hanging on that CBO, the Congressional Budget Office number. But regardless of what that number is, you still probably won't like this plan, right?
I won't like it, Gretchen, and we feel a little bit here like we're in this endless loop. It's like the movie Groundhog Day. We wake up every morning, and then the Democrat leadership tries to come up with yet another something that they throw at the wall in hopes that it'll change the outcome. But this latest suggestion of expanding Medicare may be one of the worst suggestions they've come up with yet. You've got Medicare, a program that is destined to be bankrupt in 2017, and you're going to cut it by $1 trillion over 10 years when this program is fully implemented, and then you're going to pile more people into a program that's destined to be bankrupt by 2017. So this is probably, and we're all like everybody else on the Republican side, waiting to see what this plan is and what it's going to cost. We're not being, none of those details are being shared with us. So hopefully at some point we'll be able to eventually see what the latest iteration of their proposal is.
Well, Senator McCaskill, how would you respond to that? Because on its face it does look a little curious, because to cut Medicare and then add more people to it, how would that work?
Well, first of all, the people that we're adding to it are going to pay for it. They're going to put money into the Medicare system, and they're going to be a healthier pool of people because we're taking the age limit down to 55. And that's what insurance is all about. You bring down costs by expanding the pool and bringing more healthy people into the pool. So I think in the long run, this may be a help to Medicare. And by the way, that's what this is about. It's about paying for a program. You know, a few years ago, the Republican Congress passed a new expensive entitlement program and put the whole thing on a credit card. We're taking some profits away from insurance companies. Of course we are, because they're getting too much taxpayer money now in the Medicare Advantage program. So this is about saving Medicare. It's not about destroying Medicare.
I want you both to stick around. I'm going to get Senator Thune's thoughts on that right when we return, as well as on this topic. The troop surge in Afghanistan is going to cost, guess what, billions. Is there a way to pay for it without increasing the debt? The senators stick around for that one. We're back with Democratic Senator Claire McCaskill and Republican Senator John Thune. Senator Thune, I promised you a response to Senator McCaskill on health care right when we were going to break. Your response is?
Well, look, Gretchen, if you want to see government-run health care, expanding Medicare is a way to get there. But there's a reason all the hospitals and all the doctors groups have come out against this. It's going to limit access to care for a lot of Americans. And you even had the chairman of the Senate Budget Committee, a Democrat from North Dakota, Kent Conrad, saying that this would close a lot of hospitals in North Dakota. It would exacerbate cost shifting. You'd have more and more people in government-run health care, which means the hospitals and physicians who get underpaid by Medicare are going to shift more and more of the costs over to the rest of us, to the private payers that are out there. This is a train wreck waiting to happen. It's probably, as I said before, one of the worst of the ideas that they've come up with so far. But that's a pretty low standard, because most of the ideas that we've seen so far are massive expansions of the federal government, Medicare cuts, and tax increases. Those are the components of every bill we've seen so far.
I want to move on to the next topic, because that is another cost topic, which is Afghanistan, and how this country will pay for that war without putting it on our grandchildren and their grandchildren. Senator McCaskill, what do you think about that idea that Obi had to have a war tax on people?
Well, I don't think that's a good idea in this economy. I don't think we raise taxes in this economy. And secondly, I think there's things we can do going forward that didn't happen in Iraq that can bring that cost down, and that's better contracting oversight. Contracting got out of control in Iraq, and literally hundreds of billions of dollars were wasted. We're going to pay close attention this time. There's a subcommittee that just is on this topic, looking at contracting in Afghanistan, and I think we can bring that price tag down. But ultimately, this is the right thing to do for our national security, and I'm confident that Congress is going to support it.
Senator Thune, I want to get in the discussion about the TARP funds, because there's been a lot of controversy this week that President Obama would like to use some of those leftover TARP funds now for his job program. Your thoughts on that?
Well, TARP was designed for a specific purpose, and that was to stabilize the financial markets at a time when we were worried about imminent financial collapse. That time has passed. The purpose for which TARP was created has passed. It is time to end the program. I've got a bill that would do that. We're afraid this becomes a political slush fund. And you can see already politicians in Washington view this as found money. And all of a sudden there are lots of ideas about how to spend it. The president's got them. A lot of our Democrat colleagues up here on Capitol Hill have ideas about how to spend that money. We think it needs to go back to the American taxpayers in the form of paying down the federal debt, which is growing dramatically, adding $1 trillion every single year now as far as the eye can see, Gretchen. That's what we ought to be doing with any TARP monies that get paid back in.
All right, a fair and balanced debate. Senator Claire McCaskill, Senator John Thune on a Friday. Have a fabulous weekend. Thanks for joining us.
Thanks, Gretchen.